key takeaway message from our study is that despite a modest improvement in the cardiovascular health index in the US, only 1 in 6 Americans has ideal cardiovascular health, with very significant geographic heterogeneity in the prevalence of ideal cardiovascular health metrics and cardiovascular risk factors throughout the US. These differences in the geographic distribution of cardiovascular risk factors correlate well with the geographic distribution of cardiovascular mortality, but this pattern is less robust among racial minorities. In this study, we wanted to understand the contemporary trends and the geographic heterogeneity in the prevalence of cardiovascular health metrics across the US. And we've also wanted to understand how does this relate to the cardiovascular mortality pattern across the US. Hi, I'm Vibhu Parcha. I'm a fellow in the Division of Cardiovascular Disease at University of Alabama at Birmingham. I'm the first author of the article appearing in this issue of Mayo Clinic Proceedings entitled Geographic Variation in Cardiovascular Health Among American Adults. We examined the data from nearly 1.4 million American adult participants of the BRFSS survey, which is the Behavioral Risk Factor Surveillance System survey, and we also examined the cardiovascular mortality among American adults across the US in 2017. We noted that there has been only a marginal improvement in the ideal cardiovascular health score nationwide in the last decade, that is from 2011 through 2017. We also noted that only 1 in 6 Americans has ideal cardiovascular health, and this contributes to the cardiovascular death being the leading cause of mortality in the US. We noted that cardiovascular health has improved in the Northeast and in the Southern US, while it has been kind of stagnant throughout. And one of the figures is a beautiful representation for you to understand where in the rank order does your state lie in the clustering of cardiovascular risk factors, to better understand how the population in that particular region of the US looks like when it comes to the prevalence of cardiovascular risk factors. We observed that there is a strong clustering of cardiovascular risk factors in certain regions of the US and in specifically southern regions of the US. We also noted that there is a strong association between geographic variation in the prevalence of cardiovascular risk factors and the cardiovascular mortality. While this pattern was consistent across sex, the association was weaker among Black individuals, indicating that several socioeconomic and systemic factors are contributing to the poor cardiovascular health among racial minorities. These findings are very important, provides an understanding for why the decline in cardiovascular mortality over the last 2 decades has now stalled in the last few years in the US, and how geographic heterogeneity in the distribution of cardiovascular factors and its association with the cardiovascular mortality in that region is contributing to these slowing of the decline in cardiovascular mortality over the last 4 or 5 years. The study findings also help us improve our understanding for the various barriers that are there for us to implement guideline-directed medical therapy for the prevention and treatment of cardiovascular diseases. Our study findings encourage a comprehensive approach of intensive large-scale population health interventions, which include intensified lifestyle modifications. The yield of public health interventions, such as improving access to healthcare, strengthening of healthcare infrastructure, public health information and outreach campaigns, promotion of heart-healthy lifestyle measures, all of these need to start very early in life, starting at a very early age, and the yield of these interventions may be best if they are targeted to the worst performing geographic regions, and specifically within those geographic regions among the most affected communities. I draw your attention to the fact that the correlation between the prevalence of poor cardiovascular health and cardiovascular mortality noted in our study for non-Hispanic Blacks compared to non-Hispanic whites indicates that there is a role of socioeconomic factors such as health insurance, access to healthcare, which are driving these associations of poor cardiovascular health with cardiovascular mortality, especially in the rural regions and medically underserved regions with a disproportionately higher prevalence of minority populations. We need to assess the various barriers specific to a region and mitigate them such that there is an improved access to healthcare through telemedicine, through improved healthcare infrastructure, through health education starting very early in life, and with a possible integration into the school and college curriculum. A study highlights an urgent unmet need to mitigate the geographic disparities in cardiovascular morbidity and mortality, and thereby stem the slowing of decline in cardiovascular mortality noted in the last few years.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.